Welcome to the October 20th Licensing
This
Committee
meeting is being recorded.
I'm not sure. Anyway, welcome to the October 20th, 2020 Licensing Committee meeting. My name is Debbie Veal. I'm the chairperson of this committee. And before we convene, I would like to advise all individuals observing or participating in the meeting that the meeting is being conducted consent with the provisions of Governor Gavin Newsom's Executive Order N2920. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting, and information and instructions are posted on our website. I will announce when we are accepting public comment on various issues, and the meeting moderator will open the lines as appropriate. I have advised the moderator to allot 2 minutes to each individual providing comment. This approach is necessary to facilitate this meeting and ensure the committee has the opportunity to complete its necessary business. I appreciate everyone's understanding and patience as we navigate this meeting format for our committee meeting today. I would like to ask the staff moderating this call to provide general instructions on how to participate at the appropriate times throughout the meeting. Moderator?
Yes, thank you. So to facilitate public comment, we will be utilizing the WebEx question and answer feature. When the committee chair reaches a point in the agenda at which public comment is appropriate, public comment will be requested. And at the committee's direction, I will turn on and announce the opening of the Q&A feature. Members of the public can indicate they would like to make a comment by clicking on the icon with a question mark located at the bottom right-hand corner of the WebEx screen. The instructions will be displayed on the screen for your reference. In the Ask field, typically the lower right corner of the WebEx screen, you will type, "I would like to make a public comment," and send it to all panelists. All other communications will not be responded or accepted. Members of the public, it is not necessary to identify yourself in order to make a public comment, and I will take all comments in the order they are received. Please note that the Q&A feature is being used only as a means for the members of the public to represent that they would like to make a verbal comment. Once unmuted, the member of the public may verbally state their comment. This is not a means to ask questions of the moderator or committee members. Such inquiries submitted using this feature will not be answered. If any attendees utilize profane names, they will not be called upon to prevent members of the public from being subjected to profane language. While you are free to express criticism or negative views, for the sake of the members and the public participating on the call, please do not use profane language when making public comments to the board. If you do not have a microphone, please click on the audio and video at the top of your screen and select Switch Audio. If you need further assistance, refer to the How to Join a DCA WebEx event. Thank you.
Thank you, moderator. As we begin our meeting, I would like to advise everyone that, as you may be aware, the board has so I would like, I'm sorry. I do want to make sure that everybody is aware that we are not planning on having a lunch break. I do anticipate about 10:30 having a bio break and a second one if necessary. And I would like to advise everyone that, as you may be aware, the board has contracted with the Office of Professional Exam Services, OPES, to conduct an analysis of the pharmacist licensure exam. I intend to agendize the discussion of the MPJE after this analysis is completed and a report is published. We believe that this will occur in time for the discussion to occur during our January committee meeting. Okay, with that, I would like to take roll call and establish a quorum. Members, as I call your name, please remember to open your line before speaking. Jason?
Here.
Why don't we also say if you're a public or licensee?
Jason Weiss, public member.
Jig Patel,
Here, licensee.
Song,
Here, licensee member.
and I believe that's all the committee members that are on the call.
I think Albert is here too.
Oh, I'm sorry, I don't see him listed. Albert? Thank you, Song.
Albert's here. Can you guys hear me?
Yes, I can hear you.
Yeah, I cannot get the video on, but I could hear you guys and I could speak.
Okay, yeah, there is no video for this call.
Oh, no video? Okay.
No
Okay,
video,
that's
just
fine then.
phone.
I'm okay. I'm okay then. All right.
And
Thanks.
Albert, were you-
Good morning, everybody. This is Albert, a professional, Albert Wong, professional member.
Okay, thank you. Are there any other committee members? Looks like not. Okay. Okay, with the quorum being established, the committee will now entertain any public comments for items not on the agenda. To facilitate this portion of the meeting, as previously announced, the moderator will open the phone line for individuals to provide the opportunity to provide public comment. You are not required to identify yourself, but you may do so. As we open the lines, I would like to remind everyone that the committee cannot take action on these items except to decide whether to place an item on a future agenda. Moderator, will you please open the lines for public comment?
This is your moderator, and at the direction of the committee, I have opened the Q&A panel. If you would like to make a public comment, please click on the Q&A icon located at the bottom right corner of your screen, and in the Ask field, type, "I would like to make a public comment." All comments will be taken in the order they are received. I will pause a moment to allow individuals time to access this feature. Committee Chair, at this time, we have received no requests for public comment. Would you like me to close this feature?
Sorry about that. I forgot to unmute myself. Yes, please, the feature.
Wonderful. This
Okay,
feature
at
has
this
been
point-
closed.
Thank you very much. Okay, I'm now moving on to agenda item 3, which is the approval of the July 8th, 2020 licensing committee meeting minutes. Is attached to the meeting materials. Do I have, it's marked as attachment 1. Members, I hope you've all had an opportunity to review the minutes. Are there any comments from the members about the minutes? And members, remember to unmute yourself and identify yourself if you want to make any comments. Okay, hearing none, are there any comments from the public? Moderator, why don't you open up in case we have any public comment?
This is the moderator, and the Q&A feature has been opened. If you would like to make a public comment in regards to agenda item number 3, please submit "I would like to make a public comment" and send to all panelists. At this time, I have received no requests to make public comment. Would you like me to close this feature?
Yes, please.
Feature has
Members,
been
I'll
closed.
entertain a motion to approve the minutes. Once again, please remember, if you're making the motion or seconding it, please
I can
open your mic and identify yourself.
Hi, this is Song. I can make a motion to approve.
This
And
is
do I have a
Albert.
second?
I second it. This is Albert. I second it.
Thank you. With the motion and second, I will now open, I should have done the public discussion. I did public discussion too early. So moderator, I'm sorry, but will you please open the lines to see if there are any comments now that we have a motion to approve the minutes?
This is the moderator, and I have opened the Q&A panel. If you would like to make a public comment in regards to agenda item number 3, please click on the question mark within the box at the lower right-hand portion of your screen and type, "I would like to make a public comment." Again, these are comments in regards to agenda item number 3. We have received no requests for public comment. Would you like me to close this feature?
Yes, please. Okay, with
Feature
the
has been closed.
motion, thank you very much. With a motion and a second, public comment opened and none received, I will now take a roll call for the vote. So, Jason, how do you vote?
I was not in attendance, so I will abstain.
Thank you. Song?
I was not at the meeting either, but I did observe, so I can vote to approve if that's okay.
Thank you. Albert?
Yes.
Thank you. Jig?
I was not at the meeting, but I would approve because I observed it. Thank you.
Thank you. Okay, it seems that we have approval of the motion. I will move on.
Chairperson Veal, I apologize for the interruption. Would you mind indicating for the record your vote on the motion, please?
I'm sorry, Chairperson Veal, I also vote yes. Okay, moving on to agenda item 4, which is some of the background material is an attachment 2, and in attachment 2 is the relevant law, Department of Consumer Affairs issue waiver, and relevant guidance that will be discussed. Agenda item 2 is discussion and consideration of proposal to expand the authority of pharmacists to order and administer CLIA waive tests for influenza and COVID. Members, as we have previously discussed, existing law establishes limited authority for pharmacists to perform routine patient assessment procedures indicating routine drug therapy relative to patient assessment procedures. The meeting materials detailed the existing law provisions, and in addition to provisions, the pharmacy law and other related authority reside in the area of the Business and Profession Code sections generally under the purview of the Department of Public Health Laboratory Field Services. As a committee, we previously discussed a waiver issued on May 12th by DCA Director Kirschmeyer, who issued a waiver to allow for pharmacists to order and administer the COVID-19 test in California. Along with the waiver, a guidance document was issued that provided additional detail regarding the temporary authority, and that waiver did not allow for the processing of the sample at the pharmacy, only the collection. More recently, on August 25th, DCA Director issued an order that waives specific professional licensing requirements and amends the scope of practice of pharmacists and pharmacy technicians to allow them to perform waived point-of-care tests used to detect COVID-19. Along with the waiver, guidance was released to inform and educate pharmacists and pharmacy technicians of the clinical laboratory requirement that apply under this DCA order. The waiver and the guidance documents, as I previously mentioned are included in attachment 2 in our meeting materials. With the CDC noting that both the flu and COVID-19 are respiratory illnesses caused by different viruses, coupled with the fact that it may be hard to tell the differences based on symptoms alone, testing may be needed to help confirm a diagnosis. As we enter into the flu season and COVID-19 positive test results appear to be on the rise nationally, it seems appropriate to consider the benefits to patients if a pharmacist authority is expanded to allow pharmacists to perform CLIA-waived tests, point-of-care tests for both COVID and influenza. To aid in our discussion today, several policy questions are provided. I suggest that we start our discussion with the large policy question: is there a benefit to the patients if the pharmacist's authority is expanded to allow pharmacists to perform these CLIA-waived point-of-care tests? I believe pharmacists have unique access, and especially in the community pharmacies, and especially in rural areas. And taking advantage of these factors can create an additional access point for patients that may not otherwise have ready access to such testing. Having shared my thoughts, I would like to hear from the other members, and I hope that if we as a committee do not believe that this larger policy issue, it may not be necessary to discuss further. So members, when you speak, once again, please unmute yourself and identify yourself prior to speaking so we can know who's talking. And once again, the question is that I'm asking you to respond to is kind of more the larger policy question. Is there a benefit to the patients or the consumers in California if we expand the pharmacist authority to allow pharmacists to perform CLIA-waived point-of-care testing for COVID-19 and influenza? Members, I'm all ears.
Hi, this is Song. I resoundingly support this, but of course I have questions. My actually first question is I need some help from a lawyer probably. I'm trying to understand, are we able to adjust and allow us to do this? You know, reading from the reading materials, I just could not get a complete sense of what we can do as a board to allow this to happen. Do we need to go through a legislature, or can we just do this somehow with, you know, regulatory provisions? I just could not completely wrap my understanding around that. But of course, if we can, this would be wonderful, in my opinion.
Executive Officer Sodergren, do you want to provide just an overview of if we decide to make this policy statement, and then we have a series of questions to kind of frame up what we would potentially do, what the process would be?
Sure, happy to do so. So to directly answer the question of Member O, ultimately there would need to be a change in the law to facilitate the large policy goal. For the committee's perspective, you have, I believe, a couple of different options. You can develop policy statement that supports something, or you can go further and develop statutory provisions that could effectuate the full policy goal. So it'll be up to the committee and the board to decide. Developing a policy statement in support, does certain things. Developing a statutory proposal and seeking an author and securing the necessary statutory changes takes that policy a little bit further in effectuating it. The one thing that I would, just feel like we probably need to highlight through all of this is that there's cross-jurisdictional issues. And so I believe that the statutory changes would not only apply to pharmacy law, but also some of those other general business and professions code provisions that are typically under the purview of laboratory field services.
And Executive Officer Sodergran, I just anticipate a follow-up question to that, and that would be, so if we want to, whenever you think of a statutory change, you think of the timing involved. So if we wanted to effectuate something that would be, that we'd be able to put in place for this flu season, since this flu season is when we have COVID at hand, what would this, what would your comments be as far as how we would implement that?
So I think that there's a couple of different tools that you all could consider. The board itself could not issue a waiver in this area, but developing a policy statement that promotes the expanded use is something that the board could leverage and seek a waiver through the DCA director. I believe that that is one possible option. The other is, I believe, would be a little more difficult, but I believe could be explored as well, is developing statutory provisions, finding an author, and trying to get urgency provisions into the measure that would allow for immediate effectiveness upon signature of the governor.
Okay, thank you. I think that gives us a good idea of maybe our options. As we first have to understand this policy, guys, and then we have a series of questions to understand how we might want to frame up the policy. And then, Song, I appreciate you bringing this up, and probably at the end, we need to figure out which direction we want to go. So thank you, Ms. Sodergren, for your information. Jason, Albert, or Jig, do you have any comments as far as if we should move forward with this initiative?
Yes, this is Jig. I think consumers are going to benefit quite a bit if pharmacists can perform CLIA wave tests for influenza and COVID, especially with the numbers rising and both disease states having similar symptoms. And especially in our rural area where the hospitals could be at a little distance and access to clinics could be not be available that readily, a pharmacist in the community, if given the training and guidelines to perform this test, would help us fight this pandemic in a proper way. And influenza or COVID could be eliminated if the tests are done, and it can prevent the pandemic from spreading further if somebody has COVID, is diagnosed pretty quickly.
Thank you, Jig.
Yes, this is Albert. I agree. I support the initiative. The more location we could provide the test, the better off we are to fight this pandemic. So I support that.
Jason, is there any comment you want to make at this time?
Thank you, Debbie. I do have a question, and I think, I don't know if it would be for Executive Director Sodergren or for staff, but currently, pharmacists are able to administer COVID-19 shots and tests now or not? And if we don't take action now, what happens to current services being provided in regards to COVID and flu by pharmacists?
So this is Ann Sodergren, so I'll do my best to respond to your question. So right now, pharmacists and technicians have the authority to provide point-of-care COVID testing under a DCA waiver. So there's no permanent provisions. One of which perhaps this policy could do is make it a more permanent provision. They also don't have the authority to do influenza right now. So the policy would be expanding to also include the influenza. I think that based on my reading, I don't think that COVID is COVID is probably going to be among the population for an extended period of time. So there is the urgent issue of the pandemic right now, but I think also I would encourage the committee to think long term. I'm not quite sure that COVID will ever be totally eradicated from the population, and as such, we've got the urgent issue, perhaps, but then also think long term, not only the public benefit now, but in developing their policy thinking in the future as well, recognizing that flu has been among us for many, many years, and it appears that experts believe that COVID will be as well. Is there benefit to a more permanent solution as opposed to just, the immediate waivers? So I hope that I answered your questions. Oh, and one other quick point of clarification. With respect to the vaccines, there is statutory provision that will take effect January 1 that will allow pharmacists to independently initiate and administer the COVID vaccine. I think that was your other question, Jason. Thank you.
Yes, thank you. That was very helpful. I think the benefits of extending this authority to pharmacists is undeniable. So that's all I have right now. Thank you.
Thanks, Jason. So it seems like we have agreement on this larger policy question. And so now I think it's time to consider the kind of more individual questions around the policy that could aid us in developing a proposal for the board's consideration next week. What I'm going to do is I'm going to go through each question. The question is in the board materials, and I'm going to go through each question. And what I'd like to do is let's do the question. I'll first ask the board members, and then I'll open it up to the public so we can kind of you'll get all comments on one question at a time, and then I'll move to the next one. There is currently 7 questions that we've kind of outlined. And if we get done with the 7 questions and one of the board members feels like there's something, an additional question we need to ask, it may become clear at that point in time. But let's start with these 7 to see if we can develop a proposal for the board's consideration. Okay, with all that, my first question is, what if any additional training requirements should be required? So once again, we're talking about, expanding this duty to pharmacists. So what, if any additional requirements should be required, training requirements should be required of a pharmacist in order to provide COVID and or influenza point of care tests? I guess, do we need any additional training? And if so, what do you think it should be? I think I'm just for efficiency, I'm just going to kind of go through the list of board members. And if you don't have any comments, that's fine. We'll just move on to the next one, and then I can open it up quickly to the public. I'm going to start with Albert. Albert, do you think any training is necessary? And if so, what training?
I think some kind of training should be done. Exactly, maybe a seminar or some kind of class or whatever. But I do believe there's some kind of training to make sure they do it properly.
And I'll throw out there, sometimes when we do these things, we tell people you have to do like a 1-hour CE course prior to providing these services. So is that what you mean by a seminar? Albert, would like a 1-hour CE, something like that, be what you're thinking of? It looks like you're still muted, Albert. I don't know if you want to answer that question, but I'll move on to Jig. Jig, what are your thoughts?
Yes, there should be some training because the influenza tests that are out there that requires to insert a swab into one nostril. And I believe the current pharmacy course does not have any coursework to train pharmacists to conduct those tests. And a coursework approved by the board, and it could be a 30-minute course on technique and wearing proper PPE to protect themselves. So yes, some basic training should be required in order for pharmacists to conduct this test.
Albert, looks like you're thank you, Jig. Albert, looks like you're unmuted. Did you want to, oh, you muted yourself again. There you go, now you're unmuted. Did you want to respond to my question?
Yeah, I'm sorry, I got to reverse. Yeah, I would like to see a 1-hour seminar to train them do properly. You know, I just want to, it's very important, whatever we do, we have to do it right. You know, I will make sure they have the training for it.
Okay, thanks, Albert. Song?
Yeah, so I do think that there should be training. I think we just should focus on probably trying to mirror how we did the HIV prophylaxis protocol. I don't think we should do CE requirements, but I do think we should have some sort of training recommendation that is a course. And I do actually believe a lot of pharmacy students do have experience with a lot of point of care testing. So, but I mean, yes, there should be training for sure.
And so maybe to that point, Song, as we develop this, we could acknowledge, like we did with HIV and some of the other expanded duties, that if you get the training and during your pharmacy education, that would apply. I know there's a way we can word around that to acknowledge that the schools can, include that as part of their training. Jason, do you have any thoughts?
Debbie, yeah, before go, yeah, you take that right out of my mouth. I think they should incorporate into the school curriculum to train this vaccination.
Okay.
Hi, this is Jason. I have nothing additional beyond concurring with comments already made. Thank you.
Thank you, Jason. Moderator, would you please open the line for public comment?
This is the moderator, and at the direction of the committee, I have open for public comment. If you would like to make a public comment, please click on the question mark icon located in the bottom right-hand corner of your screen and type "I would like to make a public comment." It does appear I have an individual identified as Daniel Martinez who would like to make a public comment. You will be provided 2 minutes and given a 10-second warning. With that, your microphone has been unmuted.
Good morning, Madam Chair. This is Danny Martinez with the California Pharmacists Association. You guys should have received a letter that we sent to the board yesterday on this agenda item, which outlines answers to all the questions that you're going to be discussing today. As I'll limit my comments to specifically to question 1, I did highlight that CPHA's website has a plethora of information on COVID-19, not quite on flu, but on COVID-19. And with that information, we've highlighted the fact that the training on specimen collection, which is really the training that's needed for the CLIA-waived test regarding COVID, is offered free of charge by the American Pharmacists Association, as well as other pharmacy groups who currently offer the same type of training, also free of charge. Additionally, I wanted to note that the manufacturers of the tests themselves do include instructions on how to process the specimens once they are collected. these CLIA-waived tests are designed to be very simple tests. As you might imagine, there's other CLIA-waived tests that people can take home and do on their own. Immediate one that comes to mind are pregnancy tests or blood glucose tests. These are the type of tests that are that simple. And so we don't believe that anything beyond the training on specimen collection is necessary, given the fact that there are instructions on how to appropriately process specimen collections. And additionally, these methodologies are simple and accurate, and even in the likelihood of erroneous results is negligible by the user. Additionally, CLIA-waived tests, by their very definition, carry no reasonable risk of harm to the patient, even if the test was incorrectly performed. So I would ask the committee to consider,
10 seconds.
if you're going to require these training requirements, to limit them to the specimen collection. Thanks.
Our next public comment comes from Lindsay Gullahorn. Your microphone has been unmuted.
Good morning. Thank you. Good morning, Chair Bill and licensing committee members. This is Lindsay Gullahorn with the California Retailers Association and the National Association of Chain Drugstores. First, just generally, we want to express our support for permanently expanding the authority for pharmacists to perform CLIA-waived COVID-19 tests and flu tests, and obviously are happy to be helpful to the committee and the board if you decide to pursue this, whether support or to pursue a statutory proposal. To the question of training, I just want to echo Danny Martinez's comments. I think that because training is already required for these types of tests, no additional training is needed. Thank you.
Next.
Can I ask a clarification of the prior Lindsay? You stated that you indicated that training is already. Did I understand that right? You said because training is already required.
So, not required by law, but in order to perform these tests, there's training that comes along with them. That's my understanding. So we don't believe that additional training needs to be specified or required, because pharmacists, in order to perform these tests, there's already particular, I guess, instructions, maybe is the better word, training that comes with these tests.
Okay, thanks for your clarification.
Sure.
Debbie, I would like to make a comment.
Yes, please.
I think 1 hour training is seminar is not that much to ask. I would prefer they, since they allow the pharmacist or technician to do it, I would like to see them do it properly, uniformly. And I disagree with Danny's comment that it's not important that whether they mess up or not. This COVID test, is this disease affect people's life very, important. That is the positive or negative is very important. I mean, but if we get a false test, it affect their life a lot. So I would like to see it that we do it properly, and make sure it's correct and uniformly instead of rely on their own interpretation. Thank you.
Thank you, Albert, for your comments. Moderator, do we have any other public comments?
We do. We have several.
Okay, thank you.
You're welcome. Our next public comment comes from Stephen Gray. Your microphone has been unmuted.
Oh, thank you very much. This is Stephen Gray speaking on behalf of the California Society of Health System Pharmacists. First of all, I would like to echo what Danny Martinez put forth. That seems to be a very reasonable approach, and this is very necessary. I would like to add to that in other states, the ability to test for flu has also produced additional results for the benefit of society, of the community, of patients. And that is that patients with symptoms of either COVID or flu don't know whether they have a bacterial or a virus infection. They don't know whether they just have the cold. And so they're going into pharmacies in some states and being able to get a flu test. That flu test tells whether it is bacterial or virus. And as a result, they can be referred to a provider who can prescribe the appropriate medications if necessary. So if it's bacterial, if it's a sinusitis, they can get an antibiotic. The added benefit is in those states, there has been a dramatic decrease in the inappropriate use of antibiotics because antibiotics are not being prescribed or assumed to be prescribed for viral infections where they're not effective. So CSHP supports the permanence, and it supports moving forward with a waiver, urgency legislation, possibly an emergency regulation, because it is very important at this point in time to be able to address the increased demand for both COVID and flu testing. Some large organizations are expanding their goals to get 80% of their membership, which would be over 6 million Californians flu vaccinated this year. And pharmacy needs to be a big part of that. Thank you.
Steve, thank you for your comments.
Our next public comment comes from Mark Johnston. Your microphone has been unmuted.
Thank you, Board. This is Mark Johnston, CVS Health. The federal government already regulates training requirements for CLIA-waived labs. If I could read just a little excerpt from the federal law, it says when you apply for a CLIA waiver, you have to list, and the things that will be considered before your CLIA waiver application is approved are the qualifications such as educational background, training and experience of the personnel directing and supervising the laboratory and performing the laboratory examinations and other procedures. In another section of law, the federal law requires the CDC to print training for each CLIA-waived test that exists. So this is already covered by federal law. The overwhelming majority of the states allow this without state law that complicates that. Without complicating state law like you're considering today, the federal law would rule and would already regulate this.
Thank you, Mark. That was great information.
Our next public comment comes from Lori Walmsley. Your microphone has been unmuted.
Thank you, Chairperson Veal and board members. Lori Walmsley on behalf of Walgreens. First off, thank you for this conversation. We are very much in support of the continued support of this in creating permanency to this. Understanding that there are multiple pathways to look at pursuing here, including statutory proposal to effectuate the permanent change. Something for consideration when you are talking about, in particular, the influenza testing. There are a number of states that also allow for pharmacists to prescribe antiviral treatments. As a result of this, as you all the pharmacists that are on the board are aware, it's important that a patient receives treatment within 48 hours of the beginning symptoms. So allowing the pharmacist to prescribe a well-defined treatment would be something that would also be very beneficial to the public. I would also like to echo the comments in that the others have made related to training, that this is already covered within the federal law, and overcomplicating it is something that I don't believe the board needs to do. So thank you very much for your time on this matter.
Thank you, Lori.
At this time, there are no additional requests for public comment. Would you like me to close this feature?
Yes, please, moderator.
Feature has been closed.
Board members, based on that, the stakeholder information, are there any follow-up comments that anybody would like to make? I guess let me just kind of say what I gathered from the testimony of the 5 individuals that spoke, which I appreciate, and I love this process because I think it makes us smarter and helps us create something that's the best for, for our public, our consumers. It sounds to me like everybody agrees training is necessary, but it has already been addressed if you're using, if you have a CLIA waiver through the feds. And I would tend to agree that when we put things on top of federal law, it doesn't always help, and sometimes it complicates. So I would probably tend to go in the way of training is important, and it is already covered by federal CLIA waiver training. The training is already covered through the federal CLIA waivers, but I'm interested in what the other board members' thoughts are.
Debbie, this is Jig. Yes, after hearing all the comments and CLIA guidelines clearly has some of these directions, and the manufacturers do make it as easy and simple as possible to use. Some of the inserts, I briefly took a look at one of the insert, and it seems like the steps are pretty simple in terms of administering the test. So we should not make it more complicated.
Thank you, Jig. Other board members, any other additional comments at this time on training?
Hi, Debbie. This is Jason. I really do appreciate the comments from the speakers. If I could get some clarification, I don't have what those instructions or trainings are. I don't see them before me, but exactly what is it that is involved already? Maybe from the Pharmacists Association, they say that they have some information on their website. Is it just a few paragraphs of how you administer these tests? Is there a video for people for pharmacists to watch and see? And what safety protocols need to be involved with people that are potentially have significant illness coming into the pharmacy and pharmacists conducting these tests? Thank you.
I'm actually trying to figure out how, I do know on the California Pharmacists Association website there is quite a bit of information. And some of your questions I think we are going to actually address, and the additional questions that are on our list as far as considering the policy and you know, how to handle initiating and who receives the test. But my understanding is, and it's been a while since actually I've looked at the instructions, but it's pretty complete what the manufacturer provides, because they want to make sure you administer their test correctly. But I think it also goes back to, in order to obtain the CLIA waiver, there's, you know, there is a requirement around the patient, not the patient, the pharmacist or the person administering the CLIA waived test has to receive some sort of training. I don't know if any of the other members of the committee or Ms. Sodergren, if anybody else has any knowledge or comments that you'd like to share with Mr. Weiss.
This is Anne. Sorry to jump in. So a few things. First is at the staff level, we'll go ahead and before the board meeting, pull the requirements, the training requirements that are specified under federal law so that everybody has a common understanding of what it is. And we can also try to find one or two of the manufacturer inserts. As part of this is, and as I understand, as part of the FDA approval process, the manufacturer of the test kit needs to provide information, and depending on the type of test that is being given, they have to, through the FDA approval process, the FDA will approve not only the use of the device, but then how it's used, as well as the communication that is provided to, in this case, it would be the pharmacist or the healthcare practitioner that is facilitating the collection and processing of the results. So it's done, as I understand it, at the manufacturer level, because each test operates differently, but it is part of the FDA approval process. I hear two different kinds of concepts here. One is the general overall concept of how to do the specimen collection and the processing, as well as an understanding of how to do the specific test before you. And I think that the FDA's approval as part of the device manufacturing, or whatever it's called, probably gets you to the device specific processing. It's whether or not the larger issue of specimen collection in general and those kinds of things is covered. I guess at the staff level, one request would be to allow us just to look a little bit closer at what the CLIA testing requirements are, so that when the board makes this decision, they have, you know, all of the full information in front of them. Thank you.
Okay, I'm not seeing any other board members opening up their mics. I'm going to take that as we have enough information for question one, and I'm going to move on to question two. Question two is, should we specify how test results should be communicated to the patient's PCP? And actually, I did read Danny's letter, and it suggested that it be handled in a similar fashion as it, you know, communication to PCP is handled in other expanded practices that have been provided to the pharmacist, and that is, you know, at the patient's, what I'm trying to think of the right word, the patient's agreement, the patient's, you know, provides the pharmacist with the authority or the acknowledgement to go ahead and pass it on to their PCP and provides who that is. And if the patient either doesn't have a PCP or doesn't want the pharmacist to provide it on, then the pharmacist could provide some sort of, you know, printed material that the patient would have on themselves that they themselves could share with whoever their medical provider is. So I think that, you know, Danny's probably gonna come on and say I messed up what he said, but I did think that was, you know, a good way to go with question number two. I'm now gonna toss it out to the other board members. If you have thoughts on question number two, which is, once again, should we specify how test results should be communicated to the patient's PCP? And I'm gonna pick for you guys again. So I'm gonna start with, I think Albert this time.
I don't think referrals should be required. If somebody want a COVID test, they could come in, take a test, or flu, they want to get an influenza vaccine, they should just come and get it. I don't think we should need any referral on this.
Okay, thanks, Albert. Song?
I do agree with the letter comments from Danny. I mean, the letter from Danny. So I think once we get too deeply put the requirement to tie to the primary care physician, things kind of, you know, we kind of defeat the purpose of what we're trying to do. So I think that it should just be how you said it and how Danny said it in the letter.
Thank you. Jude, do you have anything you'd like to add?
No, I agree, I concur.
Jason?
Sorry, missed my mute button. No, I concur with other board members. Thank you.
Thank you, Jason. Moderator, can you please open the phone lines for our stakeholders to make comment?
This is the moderator, and at the direction of the committee, I have opened the Q&A panel for public comment. If you would like to make a public comment, please click on the question mark within the box at the lower right-hand corner of your screen and type, "I would like to make a public comment." At this time, we do have a couple requests that have come in. Just as a reminder, we are taking public comments on the agenda item at hand. You will be provided 2 minutes to speak and provided a 10-second warning. With that, an individual identified as Mark Johnston, your microphone has been unmuted.
Thank you, Board. Mark Johnston, CVS Health. Part of question number 2 was communicating the results to the patient, and I wanted to point out that that was covered by federal law. Federal law says that the laboratory must immediately alert the individual or entity requesting the test, and if applicable, the individual responsible for using the test results when any test results indicates an immediately life-threatening condition or panic or alert values. So again, this is already regulated by federal law. I did find 2 states that require reporting to the PCP, but when I read those states' laws, I believe they've wrapped CLIA wave testing laws up into moderate and complex testing, and they didn't have the foresight to exempt CLIA wave tests from their law. But again, only 2 out of all of the other states I could find a reporting requirement like is being considered here. Thank you very much.
Thank you, Mark.
Our next public comment comes from Stephen Gray. Your microphone has been unmuted.
Thank you, Board. And again, on behalf of CSHP, we agree with the comments that generally from CPHA that it's already covered, and from Mark Johnston in federal law. I haven't read the CPHA letter, but I want to emphasize that if it is required by the Board, it should be sure to include that the pharmacists that have access to the patient's medical record that is shared with the PCP and others, that making notations in there as required and as authorized should be an adequate way to notify the PCP and the rest of the healthcare team. I also believe that some patients will want the results of their test in writing. They use it to show that they're clear. They've had a negative test for COVID now in order to participate in certain activities. And so it's not clear to me whether the letter from CPHA or the letter or the comments from Mark Johnston would require that the pharmacist, upon request, give something in writing to the patient. Thank you very much.
Thank you, Steve.
Our next public comment comes from Daniel Martinez. Your microphone has been unmuted.
Thank you. This is Daniel Martinez, CPHA. To answer Steve Gray's question, yes, it is addressed in our letter. Basically, what we're saying is that under current regulation, there are methods to notify a patient's primary care provider of any test performed on the patient into a patient record system shared with the primary care provider. We know that it does say as permitted by the patient and the primary care provider. And in the event where there is no primary care provider, or if the patient chooses to not give notification of consent, then the pharmacist should provide the patient with written record of the test as well as information to consult with an appropriate healthcare provider of the patient's choice. And I do want to note at the end of this comment that I made, we did say that this would be in addition to required reporting by any local health department or the state's Department of Public Health. We're really happy that the committee is sounding like they're agreeing with this. I also lastly want to note that these comments are really for both questions 2 and 3, which is going to be coming up as we see them kind of very similar in nature. Thank you.
Thanks, Danny.
At this time, we have no additional requests for public comment. Would you like me to close this feature?
Yes, moderator, thank you very much.
You're welcome. It is closed.
Board members, are there any other comments based on what you just heard from the 3 stakeholders that you would like to make a follow-up comment? Okay, I'm not seeing anybody unmute themselves, so I'm going to move on. Question number 3 is what, if any, and I'm going to make sure. Oh, I'm sorry. I'm looking at the wrong list. Question number 3 is, should we specify either space requirements or specify that a pharmacy must use physical barriers or other safeguards? And that's kind of my updated question. I think in the materials at one point it was what, if any, space requirements should be required, i.e. designated area from other patrons or physical barriers. So my personal thoughts on this is I tend to be one that I don't like to over-regulate. And so I don't think that we need to have any specificity here. I think that, you know, at some point we rely on our pharmacists and pharmacies to operate in a professional manner, and so I don't want to, you know, put any additional requirements in, because that could potentially, you know, cause maybe people to, you know, step away from offering what I think is going to be a very valuable service. With that, I'm going to go once again call out board members. Please, if you would like to make a comment, please do, but don't feel obligated if you don't want to. Song, I'm going to pick on you first.
Thanks, Debbie. So, you know, I mean, I agree we don't want to ever over-regulate, but I do also want to emphasize that you know, I hear stories of some people, for example, getting flu shots in the middle of the hallway of the store. And I do know that I think we have to be very strict on requiring some sort of privacy. Like, I mean, we can't just let someone put like a privacy wall and call it a day and say that that's good enough. So I do have some concerns related to that. So I think we can implement something like, you know, complete protection of their privacy when the service is being rendered, or some sort of language in that sense, so that, you know, I think we can't, you know, we don't want to be like, it has to have 1,200 square feet or anything that is, you know, crazy like that. But I think we can at least have some requirements that will protect patient privacy, and also, you know, give ability for pharmacists to actually do their jobs.
This is Albert. This is Albert.
Hey, Albert,
I
before
agree
you
with him.
speak, I want to ask our Executive Officer Sodergren a question, or maybe it's our attorneys, but don't we already have privacy requirements in our regulations that would apply in this case? I hear what Sam's saying, but I think we maybe already have it covered, so we don't have to restate it. I'm curious if you would agree.
So provisions that come to mind for me, I think, are specific to patient counseling, patient consultation, and then perhaps the larger HIPAA provisions. I think we would have to look at it through this lens specifically to see if those types of concerns that are being raised here would be covered. I don't think we previously contemplated that. So at least from Ann Sodergren's position, I would need some time to contemplate that.
Okay. I'm sorry, Albert. Please feel free to speak up.
Yeah, I agree 100% what Song Al said. You know, we should have some kind of privacy. You know, like us, our pharmacy, we have a private room and space for that immunization. So I mean, we have to be a little more professional instead just on the hallway. That's unacceptable. So some kind of privacy I would like to see.
Jig, is there anything you would like to add?
Yes, the space this tests are conducted. You got to be able to take the specimen, let it be a swab or anything, in a clean area, and you're taking samples. You don't want another 10 people be around. So it got to be in a space that is dedicated and not quite in front of a pharmacy where there are people walking by, so to speak. So some privacy is important.
Can you imagine someone sticking up somebody's nose at a pharmacy counter? I mean, that's just...
Reaching across the counter and doing it, that could be tough. Jason, I realize I have selected you last a couple times, so I apologize, but curious if, I'm not doing it intentionally. I'll call you near the beginning in the future, but do you have anything that you'd like to add?
Absolutely no problem, Debbie. Being new to the board, I appreciate hearing the other comments from the board members. I think safety is important. I do have a question, maybe a basic question for maybe other board members or staff, is what similar procedures are pharmacists currently allowed to provide, shots, et cetera, and how are those handled as far as distance, safety, and privacy issues?
Ms. Sodergren, would you like to answer that question?
So I think we need to hear from members that are actually doing the services. I think that in the law, generally, we talk about that the pharmacy needs to be neat and orderly and clean and free from rodents and those kinds of things. I'm not certain that there are other specific provisions, but someone else may be better suited to answer that specific question.
So there's nothing that we have in our law around immunizations or vaccinations and the requirements, the space requirements. Is that correct? Is that what you're saying?
So I am not aware of any dimensions, saying that a room needs to be a certain size or anything like that. I think that there are some provisions, but Debbie, I'm going to the recesses of my mind right now, which is never good. I think that there may be some provisions that say it needs to be a separate area, but again, I don't recall it going to levels of specificity there. During the break, council and myself were happy to review that and report back. But I think that hearing how things are working in the marketplace may also provide a little bit of context to frame the issue.
Okay, thank you. I mean, my understanding is in the marketplace, quite often there is a separate area with privacy screens and seating for the patient, but and so for immunizations, I believe it's working quite well, and I guess that's how I picture it would happen in this case too. And so it might be something that we just need to either circle during our break or have staff come back and look and see if we need to have more specificity depending on how the committee wants to move. So at this time, moderator, can we open up the phone lines to have, see if there's any comments that the stakeholders would like to provide?
This is the moderator, and at the direction of the committee, I have opened the Q&A panel. This is a reminder that we are only accepting comments by the reference displayed on your screen by clicking on the Q&A icon and submitting "I would like to make a public comment." For individuals currently trying to utilize the raise hand feature, I do ask that you lower your hand by clicking the hand raise feature again and follow the instructions displayed. With that, I do have an individual identified as Daniel Martinez. Your microphone has been unmuted.
Thank you. So as noted in our letter, we do have some concern about writing specific space requirements into regulation or statute when conducting any sort of this testing. Just to keep in mind, if you do write that specific distance requirement, how are people or pharmacies who are using drive-up stations or some other method, how is that going to be reasonably enforced compared to folks who are in a pharmacy getting this testing? I think at the end of the day, we all agree that pharmacists should be allowed their professional judgment to determine what space is needed for safe and appropriate testing. While we might hear anecdotes here and there about, in the middle of the hallway kind of situations, I don't believe that is nearly the standard of practice in pharmacy. And we would just really caution the board when having specific requirements written into statute. Thanks.
Thank you, Danny.
Our next public comment comes from Jignesh Mehta. Your microphone has been unmuted.
Yeah, hi. This is my first time meeting with Board of Pharmacy. And I'm a pharmacist and myself been practicing as an immunization for over 10 years. And in generally, as I echo with Daniel Martinez, saying that we do practice safe practice. I mean, there could be some isolated cases, but as long as it's our clinical judgment and our professional judgment that what is the safety and privacy for the patient. My main concern is about the drive-through practice, which is actually helpful for the testing purpose because we are not, unless we test, we don't know whether the patients are positive or negative. So in order for the patient to come inside the pharmacy, wait, and possibly even contaminate the space and or some other patients get infected because of that patient. We try to maintain our distance, but we cannot tell, keep as far as possible the distance between the patient. But we can control their distance by physical means. So my comment is we should be allowed to do the drive-through testing, and it is considered as a safe practice.
Thank you, Jignesh.
Our next public comment comes from an individual identified as Mark Johnson. Your microphone has been unmuted.
Thank you, Board. Again, Mark Johnson, CVS Health. I will note that federal law doesn't have any requirements such as are being considered here in item number 3. I did find just one state out of the entire nation that had requirements like this. And I'll remind the board that you do allow in the state of California 3 CLIA wave tests with the pharmacist being the lab director. So there is some of this activity happening in the state, and your own state law does not currently regulate this. Now, there may be other HIPAA state law or, facilities state law, but specifically in the a multitude of CLIA wave law that I'd like to comment on later in the meeting. There are no such requirements as this. And as some of the other commenters have stated, this is likely to happen in the pharmacy through a drive-through in the parking lot of the pharmacy when we get COVID testing, which is allowed federally. The CLIA wave certificate is for an address, not just for the pharmacy license space. It could happen with an additional allowance permitted by federal law at nursing homes or other assisted living facilities for patients who can't get out. So I don't think there's a one-size-fit-all answer here, and anything that would be written into rule would likely restrict somebody's practice. So I agree with the comments to leave it up to the professional discretion of the pharmacist. Thank you very much.
Our next public comment comes from an individual identified as Stephen Gray. Your microphone has been unmuted.
Thank you very much. Again, on behalf of CSHP, I would like to basically just remind that the current privacy rules or interpretations and practices did, as Executive Officer Sodergren said, center around consultation, the overhearing of information by the non-patients, non-pharmacists, et cetera. And so that this does deserve some further consideration. The issue of the testing is not just privacy, it's also contamination. And when you do a swab test, you're actually pulling virus out of the nose, for an example, which then could make it aerosolize. And that could be an issue that needs to be considered. Also, there is still the issue that the law now allows pharmacy technicians to do the testing, federal and state law under the waiver. But the definition under California law of a pharmacy technician is that they are supervised inside a pharmacy, So often these rooms that have been put outside in the unlicensed area are not inside the licensed area of the pharmacy. So the board needs to consider its policy and its enforcement instructions on both the issue of contamination when they see something happening, meaning an inspector, or whether the technician has to perform these functions inside the pharmacy. I just think it needs to be considered. Thank you very much.
Well, and I think, Steve, you said technician, but I think we're talking here about the pharmacist performing these duties right now. But thank you for your comments.
Our next public comment comes from Lori Walmsley. Your microphone has been unmuted.
Thank you, board members. Lori Walmsley on behalf of Walgreens again. I'd just like to echo the comments of Danny Martinez, the pharmacist who spoke earlier, and Mark Johnston. Our processes at Walgreens have evolved throughout this pandemic and the way that we're offering COVID testing. Not knowing what the future will hold, I would encourage the board to keep their regulations to a minimum with regards to this, as to not limit the testing. Companies are going to follow the OSHA policies and procedures, as well as any type of clear regulations, et cetera, and do everything that they can to not only protect their staff, but also protect patients. I don't think it's necessary for the board to get too specific here, because I certainly would hate to see it limit the way that organizations can offer this testing to the public, which is so needed at this time. Thank you.
Thank you, Lori.
Our next public comment comes from an individual identified as Jassy Gruel. Your microphone has been unmuted.
Hi, this is Jazzy Graywell with UFCW Western States Council. My internet's a little spotty, so I apologize if I break in and out. I'd like to echo the comments that were made by Stephen Gray and also the board of some of the members on the board supporting the need for a private space to be able to conduct these tests. There could be an exclusion made if there is a drive-through facility, because that is a more controlled environment where a patient is in a car. But however, in a pharmacy, and particularly in a retail setting, the pharmacies tend to be located in the back of the facility. So you have someone that's potentially COVID positive walking through the whole entire facility and then getting to the back of the pharmacy, where there should be a controlled space in which the test is conducted for aerosol reasons, but also to be properly sanitize in between tests. So if someone is positive, a test is taken, there needs to be a way to be able to control that space, to sanitize that space, which can't be done in a hallway, and to also protect patient privacy. We have heard numerous stories of our pharmacists throughout the state conducting tests in hallways, doing vaccines in hallways. So there really is a need for a controlled private space for someone to feel comfortable getting a test taken, but then also to be able to properly sanitize that space for future patients that are walking through, and then consumers that are walking in those hallways. Thank you.
Thank you, Jessie.
At this time, we have no additional requests for public comment. Before I ask to close this feature, would a public member by the name of Jignesh Mehta please lower your hand by clicking on the hand raise feature once again? With that, there are no additional public comments. Would you like me to close this feature?
Yes, moderator, thank you very much.
Feature has been closed.
Thank you.
Chairperson Beal? Yes. This is Ann Sodergren. One possible option, scanning through our law book, one possible solution or suggestion might be to require policies and procedures that will specify how the pharmacy is going to meet the privacy and protection, safety protections and precautionary measures that will be taken. That would allow some flexibility given the dynamic nature of the various sites that could potentially be performing these tests. It would give flexibility to the business, but it would give the board assurances that there has been a thoughtful and deliberative process in recognizing these issues and that the facility has identified how they are going to be addressing those things. Just a suggestion.
Executive Officer Sodergren, I think that's a fantastic suggestion, actually. And I think rolling into question number 4, it would also solve, around the personal protection equipment in question number 4. So I'm going to go to the other board members. So number 4 is it necessary to detail the PPE that is going to be required, the personal protective equipment? And I think Ms. Sodergren's solution here would actually cover both 3 and 4. So once again, require policy and procedure that speaks to privacy and safety precautions. So I'll go to board members to see your thoughts on her suggestion, and also kind of rope and kind of layer in number 4. Song, would you like to go first?
Hi, Debbie. Yeah, I think Anne's suggestion is excellent. We can require policies and procedures that will ensure all personal protective equipment are being used in some manner, as well as protecting patient privacy, so that then the companies can develop their own solutions that will ensure those practices. And I mean, I think and policies and procedure requirement can actually solve a lot of these questions that we're actually debating. So
I agree with you.
That's a great idea, Anne.
Jason, I'm going to move you up here. What are your thoughts?
Thanks, Debbie. No, I concur. The executive director has found a path forward that really gives assurances that the pharmacies have given some thought into how to provide these safety considerations. So I concur.
And just kind of thinking here before I move on, Albert and Jig, I'll ask you to speak also, but Song, you kind of made the comment that actually the policy and procedure could actually solve quite a few of these questions here, and so it makes me look back at even, training that the policy and procedure could also, solve the training. Exactly what we need to do training-wise. We can kind of lean on the CLIA waiver, and I know the staff is going to look into that more and what the manufacturers are required to provide, but, perhaps we can also roll that into policy and procedure. So that's just kind of a thought that came up, Song, actually after your comment, and that might not be where you were going at all. So I'm going to swing back the Song to see, what your thoughts are, and possibly incorporating, question 1, 3, and 4 for sure, and the policy and procedure piece.
Oh yeah, Debbie, you're exactly right. That's where I was thinking actually. So it seems to, we could make it kind of simple and not too complicated from our standpoint, and give, we can provide minimum necessary requirements via policies and procedures. So then the companies can have their freedom to develop training requirements. Pharmacies can develop their own training requirements, because I mean, a lot of, I could be wrong, but my understanding is a lot of these machines, it really is kind of machine specific, whatever the machine you're using. So I think that's where I'm going as well.
Okay. Jason, I'm going to circle back around to you too, and then we'll move on to Albert and Jig. So do you, if we kind of incorporate even training into policy and procedure, what are your feelings?
How about Jason or me?
I was going to say Jason. I was going to ask Jason, then I'll move on to you and Jig.
Jason,
We'll come back to Jason. Albert, go ahead.
Yeah, I agree with. I heard the comment of Mark Johnson and Steve Gray, and I agree that privacy, safety of the patient and staff is very important. So what Ann suggests on the procedure is excellent idea. So we need to address those issues. So I agree with her.
And I guess where Song and I were going also, Albert, was to possibly, since the training is covered by, and we're going to research this before we, talk to the full board, but sounds like it's already covered by federal law and possibly even by the manufacturer inserts, but maybe even the training could be dictated through the policy and procedure. Do you agree with that?
Yes, I agree with that.
Okay, thank you. Jig, what are your thoughts?
Well, we are trying to facilitate this point of care testing for our consumers. At the same time, we want to make sure that our pharmacists are protected and not getting infected from this and not taking that to the next patient they will see and contribute to a spread of any of this disease state, including the pandemic at hand. So, yes. We want to have a streamlined process of training and safety protocol and privacy all along all the policies that we make. So it's an excellent idea, Executive Officer proposed, and yes, we should work on that.
Thank you, Jig. Jason, we've kind of added to it a little bit. Do you have anything else that you want to add before we go on to the public?
Thanks, Debbie. Nothing beyond I concur. Thank you.
Okay, thank you. Moderator, would you please open the phone lines for our public stakeholders to provide their comments?
This is the moderator, and I have opened the Q&A panel for public comment. If you would like to make a public comment, please type "I would like to make a comment" in the ask field and send to all panelists. We do have an individual identified as Daniel Martinez. You will have 2 minutes and provided a 10-second warning. Your microphone has been unmuted.
So for the question specific to the PPE, we're kind of still marinating on that idea of the, wrapping this in the policies and procedures. We do believe that does provide flexibility that's necessary for pharmacies. The only concern that we would have is something that I do address in our letter is when there is a shortage of PPE. And as we've seen at the beginning of the COVID pandemic, would pharmacists then still be expected to, adhere to those policies and procedures? I mean, I guess I would imagine you could write something in there related to any shortages that do occur. But the kind of the idea that we have in here and is noted at the end is we really want pharmacists, again, to use their professional judgment, the standard practice of pharmacy, that are in conjunction with recommendations by the CDC and CDPH to determine what specifically PPE is necessary for testing. So, something that we definitely could support in terms of the overall idea of writing this into policies and procedures. I just want to make sure that that question of shortages are addressed and whether we should be focusing on the recommendations of the Centers for Disease Control and Prevention and the Department of Public Health. Thanks.
Thank you, Danny.
Our next public comment comes from Mark Johnston. Your microphone has been unmuted.
Thank you, Board. I believe this comment may be pertinent to item 3, 4, and 6. Just a excerpt from federal law. Federal law requires laboratories to, I'll quote here, maintain records, equipment, and facilities necessary for the proper and effective operation of the laboratory. So records is number 6, equipment's number 4, and facilities is number 3 on your list. That one short statement as part of a policy and procedure rule would seem to be pertinent and brief and enough. Thank you, Board.
Hey, Mark, just one quick question. Was that, you said the lab, can you say that again? Which federal law was that, around the CLIA waiver, or where was that?
Yeah, so it's in the federal CLIA waived. This is actually the amendments and rule. So it says, one of the requirements is to maintain records, equipment, and facilities necessary for the proper and effective operation of the laboratory. And, when you get a CLIA waived certificate, you're still a laboratory. You're just a CLIA waived laboratory. The pharmacy address becomes the laboratory.
Thank you for the clarification.
You're welcome.
Our next public comment comes from Stephen Gray. Your microphone has been unmuted.
Thank you very much again. A couple of comments. One of the comments in general, but maybe very important about the policies and procedures that would be required here, is that we often find that the policies and procedures, when there has been a complaint or some investigation, are the current policies and procedures and not necessarily the policies and procedures that were in effect at the time the patient received the service. So the board's requirement for policies and procedures should always reflect that the policies and procedures be dated as to the period when they were in effect, and then be kept for a minimum of 3 years after that, so that when the board is doing an investigation or when the patient is pursuing their rights under law, there is a record of what policies and procedures were in effect at the time the patient received the service. And I think that needs to be considered very much. Also, I am concerned about the lack of PPE. There is a new statute that says that employers in California must maintain a cache of PPE, but that statute doesn't go into effect until 2023. The board's policy should basically reflect that pharmacists should not be required to perform these tests at a pharmacy, at a store, if there is not adequate PPE in the minds of the pharmacists and the personnel there. Pharmacists that are performing these tests, if the tests come back positive, they've actually been exposed to a patient who is infected. And there are public policy issues around, when that person who's been exposed should be quarantined or isolated. And I'd like the board to keep those in consideration too. Thank you.
Thanks, Steve. Yeah, I would hope that the safety precautions would address your concerns. That, in the P&P, that the safety precautions would address those concerns.
Our next public comment comes from Paige Talley. Your microphone has been unmuted.
Okay, thank you. I'm representing California Council for the Advancement of Pharmacy. First, I have 2 comments. Well, 1 comment and then a question. So I want to thank you, committee, for discussing this and taking up the expanding the authority for pharmacists to order and administer CLIA waive tests for influenza and COVID. We strongly support this. And as an individual, as a consumer, and I know this is probably absurd to ask even, but would you be requiring someone to review the policies and procedures aside from when an inspector goes into the pharmacy? I mean, I would just want to make sure that, all precautions are being taken. And so, yes.
I would not envision that that the policies and procedures would be submitted to the board for review and approval. I think we have, you know, similar requirements like around misfilled prescriptions, and
Right.
the board doesn't review that. You know, at some point we do have to lean on the professional judgment of the either individual or the company creating the policy and procedures. So that's the way I would envision it. I don't actually think the board could support looking at everybody's policies and procedures.
Yeah, I thought that would be pie in the sky, quite frankly.
You want to volunteer your time? We can.
No, thank you. But I do have one more comment, and that was that a pharmacist named Jignesh Mehta mentioned preferring drive-through for pharmacies, and Steve Gray also indicated that that was probably a positive thing because of all the possible contamination of a possible COVID patient coming into the pharmacy, or even a flu patient. So I just want to say that CCAP would support that.
Okay, thank you, Paige.
Thank you.
Our next public comment comes from Rob Geddes. Your microphone has been unmuted.
Hi, this is Rob Geddes. I represent Albertson Safeway. I appreciate the time to be able to comment on this issue. I would echo what Mark Johnston had indicated, and then just to further elaborate, if the board, in lieu of creating specific requirements to allow for the policies and procedures to address those requirements for each individual establishment or organization, would be a good solution to meet in the middle on the issue, if that were the way that the board would like to go. I think that it does solve and allows for flexibility for the different types of testing that will occur based on the organization, and allowing them to be nimble and be able to change based on the circumstances when things evolve with this disease. Keeping in mind that when you consider the world of infectious disease, COVID-19 is still in its infancy, and we're just only going to learn more and more as time goes on at how to better protect ourselves, as well as how to perform more effective and efficient testing. Support the movement to make this permanent, and we're excited to see this continue to move forward. Thank you.
Thanks, Rob.
Our next public comment comes from Jazzy Gruel. Your microphone has been unmuted.
Jazzy Gruel with UFCW. I just want to echo some of the comments that have been previously made. I understand the need for flexibility and being able to include this in your policies and procedures. However, the policies and procedures do need a level of consistency and the baseline to be able to follow. So I would just throw that out there, that there needs to be some sort of consistency across different practice settings. We represent workers in the retail setting, and having policies and procedures that aren't being implemented effectively or are not being able to capture the needs that are really needed to be able to protect the patients and the pharmacists can have deadly consequences. But the grocery store or the retail setting can become a hotspot if there is an aerosol transmission that occurs from COVID testing, from having a positive patient walk in and out of a large facility. And so there was a suggestion made to have the board review the policies and procedures. And while that may be difficult, I would encourage there to be some sort of oversight over these policies and procedures to make sure that they're adequate for the setting and for the time. Thank you.
Thanks, Jesse.
At this time, we have no additional requests for public comment. Would you like me to close this feature?
Yes, please, I would.
Has been closed.
Thank you. Okay, our last couple questions. Number 5 is, should the board be notified in advance of a pharmacy providing such service? And should the board specify record requirements? And should the proposal encompass pharmacy providing patient education? Specifically around question 5 and 6, I think we can combine those together. My personal thoughts are on number 5, around should the board be notified in advance of a pharmacy providing such service. I don't think the board needs to, be notified, or there should be any kind of licensure or special requirements, because it sounds like this is an area that's has a lot of oversight, whether it be the federal CLIA waiver or CDPH. So I don't think the board needs to be notified. As far as records requirement, I actually would probably concur with what the California Pharmacists Association, Danny, proposed. So let's combine 5 and 6 together and discuss those, and then we can attack 7 on its own. Jig, what are your thoughts on 5 and 6?
Yeah, I feel that CLIA suffice the need, and the board does not have to be notified if a pharmacy initiates point of care testing.
And any special records requirements?
No, I concur with CPHA on that one. What was proposed on the letter?
Yep, okay. Song.
Yeah, I think that Board of Pharmacy, required to notify the board, I think that's a little too much. So I agree. The only thing is, I mean, we'll talk about this as someone mentioned this already, but I think once we do move forward, we really have to make sure certain basic requirements are set by us, but also we have to have a plan on how to take care of people who test positive. So that's the only thing I really want to mention before we move on to different next topic. But if we're going to go down this road of allowing us to test, then we really need to add in ability for us to treatments, which I think most of other states. I'm trying to read other states' protocols they developed. They seem to include all these. So I just want to throw that out there to everybody.
Jason.
I concur with the prior board members.
Albert.
I would like to emphasize that we should take this testing a little more seriously. Flu shot, other vaccination, not as important. On this, most of the patients come in for the COVID-19 test, they have some kind of symptom. So there are possibility they may be positive. So we have to take the safety of the patient and the staff very seriously. Make sure they're protected. So we don't want the pharmacist will be the source of the transmission, possible transmission. So we have to take all the precaution. Thank you.
I think Jason, I asked your thoughts, didn't I?
Yes, you did, Debbie. Thank you.
All right. Okay. Moderator, will you please open it up to the public?
This is the moderator, and at the direction of the committee, I have opened the Q&A panel. If you would like to make a public comment, please click on the Q&A icon located in the lower right-hand portion of your screen and type, "I would like to make a public comment." We do have an individual identified as Mark Johnston. Your microphone has been unmuted.
Thank you, Board. Just a quick comment on notification. There are 15 states, including California, that require a separate license by the state to be a CLIA-waived lab. That means that 70% of the nation relies on federal law and doesn't require this additional registration. But since California in Health and Safety Code 1265, I believe it is, already allows or already mandates this this licensure. In essence, you have notification of your CLIA waived laboratories at a pharmacy address. Thank you very much.
Thank you, Mark.
We've received no additional requests for public comment. Would you like me to close this feature?
Yes, I would. Thank you.
You're welcome. It is closed.
All right, and then our last question is, should the proposal encompass pharmacists providing patient education? And I think, once again, I would probably defer to the comments that we received by CPHA around CCR 1707.2, which indicates that, it's a pharmacist's duty to consult a patient when there's a request or the professional judgment of the patient or the pharmacist. So I believe that this is already covered in our regulations, so I don't think we need to do anything more. With that, Jig, what are your thoughts? Jig, it looks like you're still on mute. All right, let me move on to Albert. What are your thoughts? Do we need additional regulations around patient education?
No, we should not. We should not have any regulation for it, but we should have able to provide some information to the patient.
Okay. Song.
I'm good. I think that this is quite obvious. I mean, I don't think that we need to specify how to do this. It just is like consultation. I think that this will just be kind of taken care of on its own. So I don't think we need to specify patient education.
Okay, thank you. Jig, it looks like you're off mute now. Do you want to comment?
Yeah, I don't think anything special needs to be done here.
Okay. Jason, your thoughts?
No, it seems that this would be covered in the regular course of practice at the pharmacies, so I'm good.
Thank you very much. Moderator, will you please open it up for public comment?
This is the moderator, and at the direction of the committee, I have opened for public comment. If you would like to make a public comment, please click on the Q&A icon and submit "I would like to make a public comment." I will pause a moment to allow individuals time to access this feature. We do have a public comment request from Mark Johnston. Your microphone has been unmuted.
Thank you, Board. If I can, realizing this might be the last opportunity for public comment on this agenda item, I'd like to speak a little more generally. I believe California is by far the most restrictive state in the United States when it comes to CLIA waive testing. Most states just refer to federal law, and federal law is very permissive. By definition, CLIA waive tests are simple. Therefore, the feds allow pharmacies to obtain a CLIA waive certificate as a lab, with the pharmacist acting as the lab director, and the pharmacist determines who is qualified to administer the test. This means that most states and the feds allow pharmacists and techs to administer CLIA waive tests without any additional hurdles such as owners' education or reporting requirements. I realize that much of California CLIA waive law is under the California Department of Health and not the Board of Pharmacy, but as the board discusses changes for COVID testing, I would hope that California could expand to allow all CLIA waive testings like the other states allow, and the feds. personally, I believe that striking of all CLUE of law in California would be best for public safety, allowing the federal law to rule. Realizing this is difficult, I think that the restriction on a pharmacist not being able to be the lab director except for 3 tests is the largest hurdle, but 120606 is not pharmacy law. The issue of ordering a CLIA waive test is a separate issue that's not addressed by the feds, as an order is not required to administer a CLIA waive test. Sometimes it's hard for us pharmacists to separate the requirement of a prescription to dispense an RX from this concept. An order is largely a third-party billing issue and not a legal requirement. California, if you could remove, for the purpose of monitoring and managing the efficacy and toxicity of drug therapies in 405.
His time had been reached. Would you like me to move on to the next public comment?
Yes, thank you, Mark. Yes, please.
The next individual is Daniel Martinez. Your microphone has been unmuted.
Thank you. I just want to say thank you to Chair Veal and the rest of the licensing committee for taking our recommendations into consideration. We are very much ecstatic to work with the board on making this authority permanent for pharmacists for both COVID and flu. We recognize that, while we would prefer that pharmacists be given, the entire latitude that Mr. Johnson had just mentioned, we recognize there are realities of the political world that we have to deal with. And so these are well-intentioned steps, and we look forward to working with you guys on this. Thank you.
Thank you, Danny.
There are no additional requests for public comment. Would you like me to close this feature?
Yes, please.
Feature's closed.
All right, board members, we've talked a lot, heard a lot, and considered a lot on this issue. Would any of the members like to make a motion around developing a proposal to expand the authority of the pharmacists around providing COVID-19 and influenza point-of-care testing?
So move.
Okay, so you're going to, Albert, we've had a lot of questions here, so it seems like that motion would direct staff to put together a proposal, and I can work with them, but it sounds like we were leaning towards requiring a policy and procedure that would address meeting privacy and safety cautions, and incorporate, professional judgment of the pharmacist, CLIA waivers, CDPH, CDC, taking those items into consideration. Would you agree?
Yes, 100%.
Is there anybody who would like to second Albert's motion?
I can second. It's
okay. That was Jid, correct?
It's Song. You can second.
Oh, I'm sorry, Song. Okay. Motion by Albert, second by Song. Is there any other comments that the board members would like to make? So, Ann, it sounds like we're going to be leaning on you and the staff to, kind of help us pull this together. And I think you already had volunteered, or maybe it's voluntold, to get us information around the CLIA federal law requirements and specimen collection and some of the things that were brought up specifically by Mr. Johnson today, and also the information you provided around DEA and manufacturer inserts. And then, if we do this, our recommendation is to do this policy and procedure idea to the board. So we need to, figure out how we can word it in such a way that we're meeting the privacy and safety precautions that many of the stakeholders talked about, both for the patients and the employees. So I think we're going to be leaning on you to help us enormously with this. proposal. So with that said, I'm sorry, was there
Chairperson Beal, I apologize. This is Anne. If I could get a point of clarification, please. Would the motion encompass both development of a policy statement in support as well as development of a statutory proposal, recognizing that the policy statement could perhaps be used or referenced when making any kind of a waiver request now, while also pursuing the more permanent, or is the intention to just pursue the statutory change? And I apologize for seeking the clarification.
I appreciate you asking that question. I think that the proposal is for both a policy statement so we can go after a waiver and a more permanent statutory, but I'm going to look to Albert and Song to verify that. Albert, was your motion to put together both a policy statement so we can go after a waiver as well as a statutory, a more permanent statutory solution?
Yes.
And Song, are you in agreement?
Absolutely.
Okay. So yes, Anne, thank you very much for your request for clarification. All right.
And sorry, one more point of clarification. It's the committee's desire to have this prepared and recommended to the full board at its meeting next week?
Yes.
Okay, thanks.
Is there any other comments that committee members want to make? All right, moderator, I'll open it up one more time if there's anything that for the public before we vote.
This is the moderator. The Q&A panel has been opened. If you would like to make a public comment, please submit. I would like to make a comment and send to all panelists. I will pause a moment to allow individuals time to access this feature. An individual identified as Paige Tully, your microphone has been unmuted.
Okay, thank you, moderator. I just want to say again to the committee that California Council for the Advancement of Pharmacy strongly supports this, and we will do whatever it takes to help you get it through. Thank you.
Thanks, Paige.
There are no additional requests for public comment. Would you like me to close this feature?
Yes, please.
Feature's closed.
Okay, I am going to do roll call for the to vote. Jason, how do you vote?
Yes.
Thank you. Song, how do you vote?
Yes.
Albert, how do you vote?
Yes.
Jig, how do you vote?
Yes.
And this is Chairperson Veal, and I vote yes. I am going to, why don't we take a 15-minute break? And I apologize, it ended up being a little bit later than originally planned, so hopefully no one has had any problems waiting the extra half hour. But we will reconvene. I show it's 11:01, so let's aim for 11:16. Thank you.